So this is the clinical scenario I was talking about. A candidate will be with me who will doing this clinical scenario, and I will act as an examiner. So let's start. Good morning, doctor.
Yeah, good morning, doctor.
Yeah, please have a look at the scenario.
Yes, sure.
Can you explain this radiograph?
Yes, this is a periapical radiograph that shows the lower right 4, 5, 6, and 7. And the lower 6 has grade 3 furcation involvement.
Okay. So looking at the radiograph and the clinical picture, can you tell me any treatment options for this case?
Yes, the treatment option will be tunnel preparation.
Okay. Is there any other treatment option?
Yes, in addition to tunnel preparation, we can do an open flap debridement, and or we can do a root resection.
Okay. So you said tunnel preparation, root resectioning, and open flap debridement. So
Yes.
out of these three, which treatment option you are going to choose?
I will go with the first treatment that I mentioned, that is the tunnel preparation.
Okay. And any evidence for this treatment?
Uh, I don't remember right now an evidence, but my reason would be the low cost of this treatment for the patient.
Okay. Can you tell me the steps for the tunnel preparation?
Yes, for tunnel preparation, I will first start by giving the patient local anesthesia, and then I will raise a full thickness flap, and then I'll remove the bone and expose the furcation area, and and then reposition the flap apically to expose the furcation area.
Okay. Now looking at the scenario, there is a grade 2 mobility. So if you raise this flap, don't you think it will increase the mobility of the tooth?
Yes, there is a possibility that it will increase the mobility of the tooth.
So then what you should do before the treatment?
Yes, because the treatment can increase the mobility of the tooth. So keeping that in mind, I will do splinting.
Okay. And you can also see in the clinical scenario that the patient has type 2 diabetes. So you are planning a surgery. So any questions you want to ask to the patient before the treatment or before the surgery?
Yes, since the patient has type 2 diabetes, I would like to ask the patient about how long he has had this disease, and what are the current medications he is taking, and how well his diabetes is under control.
So how you are going to know that the diabetes is under control or not? Any specific test or anything you are going to do?
Yes, I will ask the patient to bring me the recent blood test HbA1c, which
Okay.
gives us a 3 months control of his diabetes.
Okay. And you said tunnel preparation. Can you tell me the advantages and the disadvantages for this treatment?
Yes, the advantage would be that it is a very low cost treatment, and it takes less time. Not lot of a time we need to spend on the surgery or the treatment of the patient. And the disadvantage is that because after this treatment there is the possibility of post-operative sensitivity of the teeth.
Okay. And any complication associated with this treatment?
Yes, caries is the main complication after this treatment.
Okay. So you are doing the tunnel preparation. So can you tell me what should be the height from fornix to the alveolar bone?
But can you please repeat the question?
I'm asking you that you are going to do the tunnel preparation, right? For this case. So what should be the height from fornix to alveolar bone?
Yes, the fornix to alveolar bone. Yes, it should be 2 millimeters
Do you
of
think it's
height.
enough?
Yes, I believe that's enough.
Okay. And how you are going to tell the patient how the patient is going to clean this area?
Yes, after I do the procedure, I will guide the patient about cleaning. I will demonstrate to him how to use the interdental brushes.
Okay. And what post-op instructions you are going to give the patient?
Yes, again, the main instruction will be the cleaning the area and use of the interdental brushes to clean the area. And I will also guide him about using mouthwash.
Okay. And when you are going to look this patient again, when will be the follow-up?
Yes, for the follow up, I will ask the patient to come back to the clinic to see me in about 10 days to see the wound, how well it is healing, and I will also remove the suture at that time.
Okay. And what do you think, what will be the prognosis of this tooth?
Prognosis in terms of, can you please repeat?
What will be the prognosis of this tooth?
Uh, well, because it has mobility, the prognosis will be poor, or rather, you can say that I would like to say it not poor, but it will be questionable.
So you said questionable, right? So
Yes.
why it's questionable? Why you're saying this?
I'm answering is based on the McQuire and Nunn classification.
Okay. So
Okay.
why you're saying this?
Well, according to the classification, there will be more than 50% possibility of attachment loss.
Okay. So any other factors you will consider for the prognosis of this tooth? Or just according to the classification, that's why you are saying? Any other factor you are going to consider or not?
Well, obviously the mobility, because that will be a major factor that will affect the prognosis,
Okay.
and the bone that the amount of bone that is over there in that area.
Okay. Thank you very much, doctor.
Okay, thank you, thank you.
Now I would like you guys to pause this video for a few moments and reflect upon the performance of the candidate. Okay, now I'm going to demonstrate how you should perform this scenario.
Okay, good morning, doctor.
Good morning.
Yes, please have a look at the clinical scenario. So, are you ready?
Yes.
Okay, doctor. Can you please explain the radiograph?
Yes, it is a periapical radiograph with grade 2 quality showing lower right 4, 5, 6, 7. There is horizontal bone loss around 50 to 70%, and there is an interradicular radiolucency in lower right 6, which suggests involvement of grade 3 furcation, but I will confirm it clinically.
Okay. So, what treatment options do you have for this case?
Initially, I will provide the patient with oral hygiene instructions, which include correct use of toothbrush, use of interdental brushes, use of mouthwash, and I will also control the risk factor as the patient has type 2 diabetes. Then I will give the patient non-surgical periodontal therapy, which includes supra and subgingival debridement of pockets of 4 mm and above with the use of LA. And then I will review the patient after 6 to 8 weeks. And on reassessment, if there are pockets above 6 mm, then I will go for surgical options, which could be open flap debridement, or tunnel preparation, or root
Okay.
resection, or a hemisection.
Okay, so which treatment option will you choose?
For this case, My first treatment choice will be tunnel preparation, as the involved tooth is mandibular and the patient has good oral hygiene.
Okay, so any evidence do you have for this treatment?
Yes, it's Nibali in 2019. The success rate of this treatment is 70% in 7 years.
Okay, and can you please explain the steps of tunnel preparation?
Okay, I will give the patient local anesthesia, raise the buccal and the lingual full thickness flap. Then I will remove all the granulation tissue by root surface debridement, and then I will remove interradicular bone to expose the furcation area and to widen the furcation area.
Okay.
Then flaps are sutured in the apical position so that it is easy for the patient to clean this area and to expose the furcation area.
Okay, okay, good. So tell me, I have a concern that as in the clinical scenario, the tooth has grade 2 mobility. So if you raise the flap, don't you think it will affect the mobility of this tooth?
Yes, there's a possibility that the mobility will increase. So before the treatment, I will splint this tooth so that it will not increase further the mobility.
Okay, this patient also has type 2 diabetes. So what are the questions that you will ask the patient before the treatment?
I will ask the patient about the current HbA1c value so that that will show me 3 months diabetic control. Also, I'm going to ask about the current medication the patient is taking, any complications he might have developed due to diabetes, or any previous episode of hypoglycemia, especially during the dental procedure.
Okay, so what advantages or and disadvantages do you think this treatment has?
As the advantages are concerned, this treatment requires less time, this procedure has low cost, and there is no need of any endodontic or prosthodontic therapy, and it is easy for the patient to clean the area after the treatment. And related to disadvantages, there is a chance that patient might develop post-op sensitivity.
Okay, and any complications that is associated with this treatment?
Yes, if the patient don't keep this area clean, then there is a chance that patient might develop post-op caries.
Okay, can you explain to me what should be the height from the pronix to the alveolar bone?
It should be the amount of space available should be adequate so that the patient can clean this area easily with interdental brushes, and it should be around 5 mm.
Okay. Okay. So how is the patient going to clean this area?
I will give the patient interdental brushes to clean this area.
Okay. And what will be your post-op instructions?
I will educate the patient that he has to keep this area clean with the use of interdental brushes. Otherwise, there is a chance the patient might develop caries. I will also give the patient chlorhexidine mouthwash for 4 to 6 weeks. I will also prescribe the patient sodium fluoride rinses 0.025%, and also I will give the patient fluoride toothpaste.
Okay, and what will be the follow-up plan for this patient?
I will see this patient after 7 to 10 days for suture removal. Plus, I have to look at the wound, how it is healing. Then I will see the patient after 1 month to check the patient clinically. Then 3 months to check the patient again clinically, and then after 6 months to check the patient clinically plus radiographically.
Okay, so now the treatment is done. You have given the instructions to the patient. And what would be the prognosis of this tooth?
Okay, according to McQuarrie and Nunn, prognosis of this tooth is questionable because there is more than 50% attachment loss. Plus, I need to consider a few other factors for the prognosis of this tooth. That includes mobility, amount of remaining bone, root trunk length, divergence of root cones length, and crown root ratio.
Okay. As you have mentioned that the prognosis of this tooth is questionable, and you have mentioned other treatment options before this one,
Yes.
would those treatment options give a better prognosis? Why not choose them?
As this tooth has class 3 furcation involvement, and all the different treatment options will have the same prognosis. But as the patient has good oral hygiene, so and after the treatment, patient can maintain good oral hygiene in furcation area. That's why I chose tunnel preparation.
Okay. Okay. Thank you, doctor.
Welcome.